Before I invite over Sam to the stage, let me give you a little bit of background on Sam. Sam is a social entrepreneur, design strategist, creative technologist, innovation evangelist, and Stafford University Innovation Fellow from the D School. As founder and CEO of NextStep Health, he serves the mission to empower communities toward mental health resilience, wellness, and recovery. NextUp Health has partnered with government agencies, NGOs, and the private sector CSR arms to provide access to evidence-based, tech-enabled resiliency tools to rural and urban communities across the U.S. and beyond. Welcome, Sam.
Thank you so much, Joe, Oscar, Tina, and Dario for setting the stage. My name is Sam Warach. This is Mike Bell.
Yeah, so don't mind me. Don't mind me. Just making sure we're good, right?
Thank you so much. So, my name is Sam Warach. I'm the founder and CEO of NextStep Health. I'm going to speak with you about how we leverage tech to help people improve their mental health. So, it's 2022, and people are spending several hours of their day on their screens. Everybody knows this. Just last week, this article came out that said that 20% of US teens are almost constantly using YouTube, with TikTok not too far behind. This is some data from the Pew Research report that was cited in that article that says about 15 to 20% of teens are almost constantly using Snapchat, TikTok, and YouTube. If anybody has children, or like Joe has nephews or nieces, then they'll certainly be aware of these trends. So just to show of hands, is anybody shocked by this data? One person. One person is shocked. One person is shocked by this data. But it's not shocking data, because we all lived through the pandemic and the digital transformation, and we all know that teens are spending an inordinate amount of time on their devices. I think my clicker just died out. I called Mike back to the stage.
It's okay, you just use the keyboard, just use the arrow.
Oh, it's still not.
Just touch the screen.
I use a Mac. This is a
Sam,
Microsoft.
don't you work for Microsoft?
Sorry, that was my fault. Come on. Here we go.
Thank you, sir.
Now you're
Appreciate it. So 54% of teens say that it would be hard to give up their social media. Contrast this with the nearly 20% that are almost constantly using the applications. This is a little bit of an alarming stat. And I think I have a little bit more updated stat than Joe cited, but about 95% of all teens have access to smartphones, up over 20 points in the last few years. Almost half of teens are almost constantly using the internet, whether or not they're using social media. Black and Hispanic teens are also more likely than white teens to say they're almost constantly online. Again, I'm just setting the stage here for the phenomenon that during the lightning talk we discussed. And what are these teens doing on social media when they're almost constantly using it? They're watching short form video content. This is one of the biggest shifts from Facebook to TikTok, YouTube, and Snapchat. This affects teen boys just as much as teen girls. They might use different platforms, but they're certainly spending about the same amount of time on the platforms. And 55% of the teens that were surveyed in this report say that they're using social media about the right amount. Again, if you extrapolate the data that almost 20% are almost constantly using it, that means that some of these teens who are almost constantly using it think that that's okay, think that that's fine. So the truth is we know that these platforms are not good for our teens. This is just the fact about it. But we know that that's not changing, because these platforms are here to stay. They're ubiquitous. They're very compelling in nature. Actually, it's not just teens. I'm sure everybody in the room uses social media at least in some way or another. But particularly the teens are very susceptible as they have a little bit more free time on their hands. Problems that surface from these phenomenon are widespread low self-esteem, cyberbullying, and a suite of other issues that poorly correlate to mental health. So we've identified a really hairy problem, a really complex problem. And now what do we do about it? We have this information about teens' relationship with screens. So what can we do to help them with their mental health, knowing that their relationship with social media is inversely related to good mental health? This is where we come in, why we exist. We're focused on reinstating individual and community resilience. So about the same time I started NextStep, I became a Stanford University Innovation Fellow, the Hasso-Plattner Institute of Design, where I learned how to take a really hairy problem in society, unpack it, and come up with pragmatic solutions and integrate them within existing systems. So I started by auditing the mental health landscape. Here's where we're at today. At least 7 in 10 adolescents and 1 in 4 adults experience a mental health or substance use condition. Rates of these mental health conditions are skyrocketing as they have over the last 3 decades, and overdose deaths in 2020 rose over 30%. This suffering jeopardizes our social fabric, and substance use alone costs society over $1 trillion a year in lost productivity, astronomical healthcare costs, and crime. I subscribe to the belief that the best treatment is prevention, and we're focused on that exactly, and I'll tell you a little bit about it in a second. But essentially, we're trying to prevent the kid in Uvalde from becoming a mass murderer before he develops severe mental illness. We're trying to prevent the 7th grader up in New Hampshire from shooting himself in the head with his father's pistol on a Zoom meeting with his entire classroom before it happens. So we're really trying to tackle these real world problems that are horrific and easy to sweep under the rug with the world of distraction we live in today. Which leads to our mission, which is to address these behemoth mental health challenges, starting with the 7 in 10 adolescents who experience mental health issues and who are in need. We do that with prevention and mitigation, meeting people where they are, which is almost constantly using their screens. So we started with the question, how might we use the same principles that incentivize use of social media to help them improve their mental health? This is NextStep Good Life. It's a web and mobile application, which is an evidence-based prevention mitigation program to foster mental health resiliency in the form of a social media application. We lean into teaching healthy coping skills, spreading positivity, and all the benefits that come from social media. You know, it's true, there are a ton of benefits that come from social media. We're also intentionally mitigating for a lot of the downsides that lead to cyberbullying, et cetera, low self-esteem. So NextStep Good Life, as it's a social media platform, is also an evidence-based resiliency cultivation platform. It's used by schools and youth-serving community-based organizations across the city, as well as across the Northeast and sporadically beyond that, to prevent downstream mental health conditions. We do this focusing on prevention and health literacy, providing educational media algorithmically recommended to users based on how they're using the app, to provide them with the relevant support that they may need. And if they are identified as in need of higher level support, we can also connect them to our collaborative health partners. So how does this work? In essence, 50,000-foot view, youth find our application, they use it, they're recommended evidence-based content based on this framework. We have a research partner we work with. And if they need a higher level of support, we can send these kids out to health and social service providers as well. Here are some of the social services that we offer in NextStep Good Life's sister platform, NextStep.Health. On the left there, you've got the care map, which has over 100,000 resources ranging from inpatient and outpatient facilities to medication-assisted treatment wave providers. And if you're interested in checking that out, you can just go to nextstep.health/care-map. In the middle, we've got free mental health screening tools for addiction, depression, anxiety, PTSD, adverse childhood experiences. And on the right, we've got dozens of other helpful resources like the Suicide Prevention Lifeline, Planned Parenthood, and other substance use dependency hotlines. So we had the wonderful opportunity to start working with the mayor's office in 2020. And Oscar, someone I've known digitally for a number of years, but it's great to see everybody in 3D. As Mike was mentioning. So we are focused on the same mission as this initiative was focused on, and building a public interest technology and leveraging tech to make mental health services more accessible. And we had actually previously been working with the state of New Hampshire from 2018 to 2020 and still into today. So the timing was really great. We started working on this before the pandemic, and when the pandemic hit, it just became a lot more relevant. Here are some of the outputs and outcomes from the initiative we ran with the mayor's office. There's also reports on the table if you guys want to pick up a copy after this. Here's a QR code, not to the report, which you might think would make the most sense here, but actually to nextstepgoodlife.com if you want to download the app. So I am Sam I am. If you're wondering who's been speaking with you for the last 10 minutes, I'm a mental health activist, systems designer, Stanford University Innovation Fellow, and also former mentor/champion at the Behavior Design Lab at Stanford, which is formerly known as the Persuasive Technology Lab, which is incidentally where Mike Krieger, the co-founder of Instagram, started working on Instagram, leveraging these principles of behavior design to get people interested in using the application. There's more information on my website. Also, if you want to see other talks, samwarach.com. But we've laid the foundation for reinstating mental health resilience for folks across the US and beyond. I mentioned we started working with government agencies a few years ago. We've also worked with NGOs like the Clinton Foundation and a couple private sector companies as well. And right now we're focused on more partnerships to scale our impact, right? We're not excruciatingly well funded, so we're still in the very early stages here. You guys are getting a sneak peek. Here are some of our existing clients, partners, and supporters. And if you're interested in working with us, please drop me a line, sam@nextstep.health. Thank you so much. Appreciate it. Thanks, Mike.